Okay. Here, double duty this. And here we go. Okay,
Sorry?
there's supposed to be our. Oh, I was supposed to be here. Okay, yeah, go ahead.
So Oregon OBNM public meeting starting at 1:41 on Monday, October 13th. Okay, I don't need to read anything for this, right?
No.
Okay, roll call, Ryman, Eric, Indy.
Mary Beth Baptiste Edie.
Ryan Martin, Indy.
Regularity Andy.
Yeah, that's me, Indy.
Zero Fernandez.
Josh Looper, public member.
All right, case resolution update. Second.
Okay. I don't know if they are 22-11-30. Civil penalty.
Okay, hold on, where are we? What are you doing?
Case resolution.
What are you asking?
Do I see anything for the first one?
No.
22-11-30.
I don't think so.
I said no, sorry.
Okay.
I'm trying to find like why I can't have my little bookmark.
Okay, case 24-03-09, I make a motion to dismiss. All in favor? Or any discussion? No discussion? All in favor, vote aye.
Aye.
Any opposed? Motion passed.
Oh, this.
Wait a minute, hold on,
Oh, this is great.
hold on. What did you just, what number did you just do?
I did 24-03-09.
Why?
She asked you about 22-11-30, if you should say anything.
Yes, okay. So 22-11-30, yes, you do need to say that the violation was found and.
Okay. Violation was found in discipline is a civil penalty.
Yes.
I didn't take those.
Oh, sorry. Yes, okay, sorry. Okay, 22-11-30. Make a motion to.
I make a motion
To impose civil
to
penalty.
impose a civil penalty. Any discussion? All those in favor? Any opposed? Motion passes.
And just get a second next time, that's fine.
Okay. Case 24-06-17. I make a motion to dismiss. Can I get a second for that? I'll second the motion. Any discussion? All those in favor? Aye.
Aye.
Any opposed? Nay. Motion passed. 24-11-35.
Do them together.
Violation found for,
Do them together.
oh, sorry, and 24-11-36. Violation found 850-050-0010 148C 850-050-01904C and ORS 685.110. With the discipline to be chaperone while patient is under the influence of a sedative or during a sensitive exam, and a chaperone must be offered for all procedures. The chaperone cannot be a family member of the doctor. Probation 5 years, $25,000 civil penalty, $25,000 civil penalty, and 3 months suspension of license.
Second.
Any second?
Second.
Any discussion? All those in favor? Aye.
Aye.
Aye. Any opposed? Motion passes. Case 24-01-04, I make a motion to dismiss.
Wait, did you say 25?
25-01-04,
Okay, sorry.
I make a motion to dismiss.
It's Ryan, Eric, second.
All those in favor, oh, any discussion? All those in favor? Aye.
Aye.
Any opposed? Motion passed.
Did you do 24-03-09 and I missed it?
I did it out of
That was good.
because I didn't.
Okay, that's right. Okay,
Okay, great. Need a motion, make a motion to continue investigations over 120 days.
I make a second.
Any discussion? All those in favor, aye.
Aye.
Motion passes. Make a motion for approval of August 11th, 2025 executive and public meeting minutes.
you technically cannot do that.
Okay,
Okay, I make, oh, because it wasn't here.
approval of August 11th, 2025 executive and public meeting minutes.
Make a motion.
Any discussion? All in favor?
I,
Opposed? Motion passes. All right, West Coast Health Alliance statement or ATF.
I have to remind myself what to do.
Is
For us to be aware of it,
it month?
vaccination.
I am having a very difficult time keeping my word packet open. I'll have to get it over. There's gonna be a lunchroom, they use it as lunch next door. Okay,
Yeah, what's the point of this?
I don't know, from what's hold on. My packet keeps. Oh. So, just so the nursing board and the medical board are working on getting this West Coast Health Alliance together for like the Western Bloc states, right, Washington, Oregon, and California for now. Based on the fact that CDC and Department of the federal government is not necessarily in keeping with what medical standards that the states have traditionally. I'm trying to be apolitical, it's really hard. Anyways, so I just want everybody to be aware that this alliance is forming. They asked me to spread the word to naturopathic physicians if anybody wants to participate. So I didn't know if you all had any opinions about this, or otherwise I'm gonna put it in the newsletter. That, just to be aware.
So essentially, it's the same, we're forming this alliance because we disagree with the federal government.
Yes.
states are saying.
These 4 states disagree with the CDC.
Well, the direction that, right, the direction that, right, that, you know, the direction that the Department of Health and Human Services is going, right, regarding vaccinations and whether or not, you know, the vaccination schedule, whether kids should be getting MMRs, whether, you know,
Okay,
because clearly the federal government is making claims that have gone against what 20, 30, 50, 70 years of.
what are they saying? I thought they just said that they no longer recommend a COVID booster.
Well-
But
quite a
Oregon,
number.
Washington,
The federal government is moving towards all like delay, like, well, it depends who listens to the federal government, right? Like Trump is saying that he wants him to look into separating the MMR vaccine into separate vaccines, deciding whether or not
okay, but they haven't made any policy changes yet, have they?
There are
No,
policy changes regarding COVID.
yeah,
That's the only one. That's the only one I know.
There is a policy change regarding the NMRP, and it's a time,
yes,
those two, I do know those
That's
two
the
exist.
policy changes. And so this alliance is saying we disagree with policy changes. You have the
Essentially-
option to follow us or follow them.
Well, that part isn't necessarily established, but it's essentially a continuation of the former COVID alliance that they did during COVID in order to respond to that for those particular states as well.
and I think one of the things that, and this is my understanding, and you are all the experts here, but my understanding is also that when federal DHS, right, makes changes in recommendations for vaccines and vaccine schedules, that affects the volume of vaccines that are coming through the states as well as your ability
It is
to
reimbursement.
for reimbursements of insurance. So what I understand the West Coast Alliance is trying to do is to kind of circumvent that, so it can still be paid for by insurance and the supply chain remains. So,
Maybe precedent. I feel like during COVID, there's a line we got together and said, we disagree or we don't agree with this, that was ever a thing.
100%. And there are alliances across the country that did exactly that and are probably doing that now. So, yeah, no. Yep. Interesting time.
Yeah.
But yeah, this is just a kind of FYI situation.
Okay. So it's kind of like if you're a provider and you feel one way or another, you have support.
Or just, well,
Just to know.
just to know that this is happening and what you know, what you want to do. If you want to do anything.
Okay, just another just notice about the 5 meter protocol, what random small thing.
What? The 5 needle protocol, okay,
This is a builder
I
contract?
know, like, nothing got passed, but
so, right?
All things.
Well, but actually, here's the thing. This was part of the reason why the acupuncturist board, the chair of the acupuncture, and Josh, I'm gonna need you to chime in here. This is what part of the reason was one of the reasons when we approached the acupuncture board about whether coming to join us would be, you know, would be considered by them. And one of their statements to us, the chair of the acupuncturist association, said no, because it was because they were part of the Oregon Medical Board, and the Oregon Medical Board had such clout that this was not passed in the last legislative session. When in reality, nothing was passed in the last legislative session because the Republicans left. So in this session, you aren't allowed to leave anymore, and so things actually got passed. So this is kind of a twofold thing. One, I really, and this will dovetail into the next conversation I'm gonna have about our financial situation. I really think that it is time to re-engage with the acupuncture, the full board, not just the chair anymore, the full association, to discuss whether or not coming to join us in the naturopath board is best for both professions. Second of all, I got a ton of questions about this, whether or not this means that NDs without an acupuncture license can now do this because it appears that you just need to pass whatever course this is. So my inclination is to say, yes, as long as you pass what the medical board says, we're not stopping you, but I wanted to just make sure that that seems right.
Can't believe we're even taking time on this, but yeah.
Right? Like, no, I just wanted to, but I do think it's important to keep our eye on what's going on.
Oh, no, yeah, I agree.
saying that we're gonna allow anyone who's taking this course can do, if they're an MD or a licensed practitioner, they can do 5.
Yep.
Yeah.
So it's basically allowing them to do acupuncture without acupuncture training.
Exactly.
Practitioners. You
Okay.
And that includes
So
you.
the acupuncturists are probably a little bit upset about this.
Very,
Okay.
which,
we had nothing to do with it.
Oh, we all right. We're heard about the dry needle. With this.
am I wrong, Josh? Am I misstating what the issue is?
No, I don't know that really anyone in our community knows what the true issue is. I don't think anyone's real. I mean, our association, for once, I'll just, if everyone doesn't know, so the acupuncture, we're under the OMB. So it'd be like if the naturopathic board, so to say, was under the OMB, but had no board member that was an ND. So the acupuncturists have a committee under the OMB. We don't have representation on the board outside of a committee, a subcommittee. And so what the association is saying, well, they're calling the 5NP that's happening a setback, and they're blaming involvement in the association for our own board not protecting what we do. So it's kind of tricky, and I don't think people are really following what's actually happening. At the end of the day, I don't know that it's a huge deal. I think for our board, I think ND should try to be involved in whoever gets to do 5NP along with all the other practitioners. But there's a big reason why acupuncturists should be interested in finding representation in a better way that could be with us.
Yeah, and we're gonna start that process in the new year of reaching out again so we're better prepared. for the next legislative session.
So, but maybe the Oregon Acupuncture Association needs, because it sounds like they didn't know that this was an option. Like their members need to know,
Well,
and it was just shut down by
it was shut down by the board.
the Oregon Medical Board.
No,
Acupuncture
sorry, I'm using the wrong word. I reached out to the president of the Acupuncture Association. And they did not want to, and you were part of this.
No, I think that was the person sitting on the acupuncture representative as part of OND.
No. She was the president of the association. And it was the president of the association that said no for the association, that they did not want to join, they did not want to entertain joining forces and having it be a dual board between.
Okay,
Oh, right, no, the medical board said whatever the association wants.
okay,
And we tried to work that out, and one of the main reasons she said that she didn't want to is because this bill had failed in the prior session, and she knew that's because they had the clout of the Oregon Medical Board
oh,
behind them. When in reality, it was because almost everything didn't pass in the
Okay.
last session. So now, here we are, where it passed in this session, because everybody had to stay in town, right, or not be able to run again. And it got passed, and from some communications that you guys probably should have seen as acupuncturists, it appeared that the association board was saying to the membership, you all needed to step up and lobby this and do better, so we don't have setbacks like this, right, Josh?
Right, even though it's our board that's allowing this, like the OMB. So there's no acupuncture board, there's the OMB, and we have a subcommittee. And then no members were never, no one ever told the members about this discussion or that this could be an opportunity for us.
Yeah. So,
so how do we communicate to the members?
to the association members,
Yeah,
well, I am no longer going to only communicate with the president, right? It's gonna be the entire board.
okay.
And so, but we should strategize about that next year. Okay. All right, so on to the academy.
They have a beautiful informed consent. I'm gonna keep that
You are so funny with it.
for a while.
Okay,
Chaperone and informed.
okay.
Legally.
So, the ketamine prescription. So now, as you can see,
It could become a problem.
well, see, I'm not convinced. No, it is. One-time continuing education required prior to administering or supervising the administration of IV and injectable ketamine. So it's not sublingual.
Intranasal, sublingual, all that. I don't know what the original discussion was. I would just go back to that original one and whoever we decided at that time should be in here.
Right, so somehow there was a translation issue. And it might have been just the title of, it might be just the title, because the education is the same. I think it's just the title is incorrect.
Yeah, I think it was supposed to be any non-topical forms.
Well, that's what number 2
Hey,
is.
you guys remember any of that?
Vaguely.
That's what number 2 is, for administration of non-pain management purposes.
That just means that if you're doing IV and you're doing IV for non-pain management purposes, you also have to do 2 hours of ethics, because that's the ketamine
Right.
assisted therapy. So that has nothing to do with any of those other forms.
But I think the rule itself, there's 1 and 2 are still correct. It's just that the title is,
Oh, yeah, I'm sorry,
So
yeah.
just say super administering or supervising the administration of ketamine, all forms. right?
yes.
Well, do we still want to do that for topical or?
But that's what
is that
never-
For topical. Like a compounded
Oh, you're
topical
right.
prescription, like.
But we,
Wait, so for non-pain management purposes,
It's,
the ethics.
that's when you have the ethics.
so if you're doing it for pain, you need those 4 hours. If you're doing it for anything other than pain, you need 4 hours plus 2 of ethics.
Okay, so one-time continuing education required prior to administering or supervising the administration of ketamine for non-pain,
No.
non-topical ketamine.
Yes,
non-topical ketamine. So I just,
Any form of ketamine that is administered non-topically.
okay, so administering or supervising the administration of non-topical ketamine.
Correct.
That should be the title.
Or maybe it should just be include intranasal and supplemental. In addition to IV.
Well, no, because
I would say any form of ketamine
that's not,
other than
that's,
topical.
oh, okay, all right, I messed that up. I didn't mess up the rule, I messed up the title. Is the problem. All right, I will fix that.
Okay, updates draft OAR.
Yes, so, trying to see if our friends trying to join us. Oh, I don't think. Okay. So I repealed the mask rule because there's no longer a emergency. So I'm gonna put these two things together. So I was going to revise the rule. So we have to have, like we discussed last time, that we have a rule that there's a statute that got passed that said basically you get a pre-hearing before you end up going to naturopath school or nursing school or medical school that says, hey, does my criminal history keep me from becoming, if I go through school, are you gonna tell me after I spend $200,000 that my convictions will not be licensed, right? And so a statute was passed in this last legislative session that said that people have a right or opportunity, or right is loose, but an opportunity to petition the board to say, hey, here's what my criminal convictions are, is this gonna keep me from being licensed? And some boards are charging and some boards are not charging. I had taken language from the standard language where it included a fee for that, an application fee for that. We discussed it at the last meeting, you weren't here, right? We discussed it at the last meeting and I said, hey, since we don't have to do fee increases, I'm gonna go ahead, and I wanted to go ahead and delete that fee because I didn't have to deal with a special session of the legislature just for the $25 or $15 or $50, I forgot what it was, for these pre-hearing applications. Well, guess what? We do have to go to special session to get fee increases in February. And it is not, obviously, because of the extravagance of our board meetings or the extravagance of the board. The supplies and services, the state services have increased astronomically, like higher than what we projected. Where in one case, like our the DAF services that helps us, increased 37% from last biennium. And so what ends up happening is, and we've talked about this a million times before, we are the only ones that are seeing an increase, right? So everybody, it all trickles down. Everybody passes on those increases in cost of services and whatnot to their clients. And for the larger agencies, they can absorb that or pass it on. We have a finite number of licensees, and so there's only so much we can do. When I originally wrote this, there was a huge problem with our budget to the point where they thought we had like $0 right now, that we weren't going to make it to our renewals. Fortunately, that was a spreadsheet error, not of mine. A spreadsheet error from our financial folks, Total Exit, where they were writing off the remainder of our civil penalties in October instead of December, which is why it looked like we had $0. But we won't have those $0 until December, and by then we'll have all of our renewal money, so we won't have $0 anyway. So my original speech to you all was way more dire. But we can back off of that now. But we do have to raise fees. And I'm looking at two options between the short term, where it gets us through the rest of this biennium and next biennium, or a longer term, which means we would raise more fees now. So I have to decide, we have to look at the numbers, but there's a way worse story I was gonna tell you. But I found out on Friday that it was a mistake. We do need to have a couple meetings remotely instead of in person, just to save some money. I'm gonna suggest February, because that is always the meeting where there's a snowstorm or an ice storm or some sort of something. That we're always on pins and needles, if that's gonna exist, and then August, because people want to not be here and be on vacation. So for now, February and August. We may have to look, along with raising fees, we may have to look at your all stipends again and see what the rules are. But I'm gonna hold off on that for now. But I did want you to know that fees will be increased, and we're gonna look at new ways like, of kind of spreading it out, processing fees, maybe, once again, Rob, you're not Robin at all, you're Megan. Looking at your idea about some sort of nominal application fee for C, right? Like, maybe if you're a provider and you wanna do, 5 a year, you have to give us $200, like, we're gonna, instead of having it be piecemeal, maybe have like a season pass, right? Like, or something. Because that does take a considerable amount of time and resources, and it seems like there can be a way to raise the funds that way.
I would like to say I support a fee increase, and I don't instead of kicking it down, we should do the big one sooner than later, because we're still gonna have less licensees coming forward. The schools are still less and less and less than what they were. 1, 2, yeah, I don't know, I mean, yeah, we've got to, like, I feel like our whole revamping of the CE, I wish we could have thought more about how to make that revenue generating.
Well,
Well, now it's like we're starting, but we just like, we're not hiring anybody unless you fit,
but it has been, the number of applications is so much small, like, have you guys been getting?
No.
Yeah, so that means I've been doing the majority of them. It has been way down. Way,
Because I think all those people are just going through ANSIAC or whatever.
yes, which is exactly what they should be doing.
Right.
Right.
So then who would we be charging the $25 or $200 to?
There are certain providers like that have
Okay.
like long standing, right? But I am always cautious about that, right? Because I feel like I don't want to hurt our licensees who want to do something creative.
Yeah, but if we are no longer viable, I mean, literally.
Yeah, I know. I'm just trying, I'm thinking of lot, and we'll discuss them more in December. Robin has thought of a couple of things. I said, we just have to get through this meeting and then we can think more. But there is gonna be a fee increase. I do think ripping the Band-Aid off and having just the bigger one, it won't be for this session, obviously, because you're all starting to renew next week. If we're open earlier this year, hopefully people will apply earlier, but so yeah, so there's gonna be a need for a fee. But and I am also concerned about not only are the schools less and less, but if those bills, which I haven't heard something about them in a while, but the bills that the federal administration was trying to have to get through, where they were capping student loans at a certain amount for undergrad and grad school, and then total, right? Yeah, yeah, so that is gonna be, so I am,
And I've also heard like a lot of people that practice out of state that maintain the Oregon license have been like, we're going to other states because our CE requirement is just getting more cumbersome. I mean, I've heard that feedback also. But I don't think we should change things, but I'm just saying there's more reasons what we do.
well, the issue about us becoming more cumbersome is because we actually allow Oregon licensees to apply. Everybody else is like, you can only do approved CE. Right, so we're more cumbersome because we're allowing them.
No, cumbersome of like however many hours, plus this many hours of this, and this many every other year, this thing.
I think that's urban legend because we are far less complicated in California.
In Washington?
Yeah, they actually have to have in person, like they don't, like in California, you have to have the majority of your hours in person. And Washington doesn't have any of our like, write a book or that kind of stuff, right? Like,
Yeah.
so we're like, that's urban legend on that. I mean, it's something obviously that we should address, but it's not true. The cumbersome thing is that we allow people to apply, right? So we wanted to make it not cumbersome. You can only take this education, knock yourself out. But people had a fit about that, and certainly had a fit about it being in person like the rural communities,
Very big.
right? And I agree with that, right? Like, you know. So. Okay. I have nothing else. Does anybody else have anything?
Was that the budget challenges?
Yes, it was way worse till they,
Okay,
on
okay.
Friday when they found out it was a,
No public comment?
error. It was gonna be dire. Now it's just bad.
All right, we done?
No, no.
Public section?
No.
He has something.
Okay,
sorry.
last time it was also shoved in.
Oh, no, didn't mean to do that.
Next time, can we please add the agenda item, something to talk about the chaperone policy and a written consent for procedure. So we've seen this is not coming out of the blue. This is coming out of cases that I've seen here.
Yeah, careful.
Okay, I see the need for it.
Yeah.
Can we discuss it, please?
Written consent.
Informed consent.
Oh,
Written informed consent for procedure, written.
okay.
I
And chaperone.
Yeah.
Yes. And I just want to remind everybody, if you are keeping notes on paper, please make sure that you make copies of those and send them to Robin, because we have to be the sole keeper. And if you're keeping notes on your PDF to save whatever, like you can just print those pages, that you don't have to send the whole packet. Just print the pages where you've written notes and send them to Robin, because if there's ever, you know, a discovery of class, we have to do this. Anything else?
I make a motion to adjourn. All those in favor?
Thanks.
All right, public meeting adjourned at 2:12, Monday, October 30th.